they don't last long on bed. So the best thing for them to do is go and buy Viagra and use it. Now, another thing that makes people to also take Viagra without medical prescription is the fact that they are suffering from maybe over excitement. Okay, now you met a girl online, you'll be talking for a long period of time, and you feel that you're going to meet her in real life. Two people happen to meet. Then she was like, you look so cute and handsome. I hope you have energy in bed. I hope you can perform. Not knowing that you're not good. Then you now feel like, okay, fine. I think this girl is coming to my house. Let me go and buy Viagra and make sure that I impress her. She don't feel disappointed. So that's another reason why some guys out there also go to take Viagra too, which is not supposed to be so.
To create the first good impression.
Yes, to create good impression. Just imagine Mr. Joseph have big muscle and is vibrant, and on the other side it does not go well. So that becomes a laughing stock. So that's why some people engage in taking the Viagra. Maybe somebody have told them something that have pushed them into taking it, but it's not supposed to be taken like that, because medically it's supposed to be prescribed by your professional medical doctor based on the fact that you are actually suffering from erectile dysfunction. So another side effect you can see is blood vision. When you take it, you might be having blood vision, meaning that you might be seeing as if the places are moving, but they are not. You might have profuse sweating when you take it. So when you are performing the activities, before you know it, you start sweating profusely. You might also be having pains on your joint. So another one is more like musculoskeletal pain on the muscle and pain on the back. So you also feel it when you take Viagra. Those are some of the things we need to have in mind before thinking of taking it, because it has, as you are growing older, you start having problems with vision. Okay, you start having eye problem. Why? Because the area for sight in human is at the back of your head. I don't know if you're aware of it.
No, I'm not aware.
This is the occipital, the back of your head. That's where the striated area for vision is located. So that's why you discover that when somebody have an accident and fall to the ground and hit the back head, the first thing that will be affected is vision, is the sight. If you have an accident and hit by the side close to the ear, that's the temporal lobe, you'll be having problem with your hearing. So those things are things we need to know. Why? Because when you take Viagra, your vision might also be affected as you are growing older with time. Yeah. So I will always advise young adults or those growing up should avoid the use of Viagra, especially when they are not having any medical related problem like erectile dysfunction. They should avoid it. They should avoid it. And this will also bring to the fact that there are many reasons why some guys don't even last long. Yes, over excitement. You are too excited, you have met her, before you know, you people engage and you have 5 seconds, 10 seconds, you have released. Over excitement can be one of the factors. Then anxiety can also be a factor too. Why some men don't last long? If they don't last long, their mind will be tuned to taking Viagra. So anxiety is one of them. How does anxiety work? One, the fear of the fact that you may end up contacting sexually transmitted infection. It will make you to come fast, to ejaculate fast as a man, because you might not know the person too well. Maybe you met on social media, or it's a random girl you just picked. So you are scared. Before you know, you are so much afraid and you have released. Another thing that anxiety can cause is what we have to, we call the fact that the condom burst. If you want to engage and you know that the condom, you are already having this fear in mind that this condom is going to burst during the process, doing penetration. If the condom is going to burst, that fear alone will cause you to release faster. There are many reasons why the use of condom is not 100% safe. One reason is the fact that if the condom is expired, before you know, it's leaking. Another reason is the fact that if a lady should shave before sex, before coitus, sexual intercourse. Now imagine Amaka want to meet John tomorrow. Amaka have gone to shave, right? Unfortunately, John said he's traveling to another state. He will return in 2 weeks' time. After shaving, after 2 weeks of shaving, you know that the new hair that are coming, they are very sharp and thick. And some guys like using this fact that doing coitus, doing knacking, let me use that word, doing knacking, they will want to use the penis to flap on the mons pubis. The mons pubis of a woman is that area at the top where hair used to grow. So try to do that act alone. The sharp edge of those sharp hair growing can also pierce through the get it busted. And before you know, you end up getting her pregnant, and you'll be wondering, I use condom. That baby does not belong to me. So that's another factor why it is not also, use of condom is not so safe. So anxiety can play a role why some men always 5-10 seconds, 60 seconds, they are out. Then men that also take excess of sugary substances. I will ask you now, what's your favorite drinks? You tell me Coke and Pepsi. I will ask you, what's your favorite snack? You will tell me it's cake. Now, as you are consuming this cake, are you exercising? If you don't exercise, you are not metabolizing those sugary content from your body. So that's why exercise is needed. So if you're in your house, at least have a TMT, treadmill, like the one I'm seeing in front of me, to burn out some calories, because it's going to help you a lot. So the best way of how you can, work towards the fact that you can control yourself or to even last better is via exercise. So you do your exercise, you do diet modification, you modify your diet. It's also going to help a lot. And also do exercise. Instead of telling young guys going to take Viagra, why they not take watermelon?
Does watermelon help?
Yes, watermelon helps a lot. How does it work? When you start taking watermelon, make it as if it's a therapy to you. You can use it for like 1 month straight up as a regular therapy. Now, watermelon contains what we call an amino acid called citrulline. And this citrulline also helps in the formation of one particular amino acid in the body again, called arginine. Now, it is this arginine that is used to produce nitric oxide. The nitric oxide in your body is what is responsible for increasing blood flow to the thereby improving sexual performances and physical activity. So why won't you use watermelon instead of going for Viagra, that you know quite alright that it has side effects that's going to affect you in the nearest future?
You are saying so much. Everything you are saying right now, has it been scientifically proven? I'd like you to tell the viewers what your professional background is.
Okay, my name is Charles Ode. I'm a certified physiologist, and I graduated from the University of Calabar Medical College, where I had hands-on clinical experience in internal medicine, where I do more of ECG, electrocardiography, meaning that I work with patients with cardiovascular diseases, heart problems, and respiratory problems. So those are my major areas. So I'm just everywhere when it comes to clinical settings.
So how do you know so much about this topic?
Yes, I know so much about this topic. Why? Because while I was still in school, in medical college, my course, physiology, is a broad course.
What's physiology about for those who don't know?
Okay, for those of you who don't know what physiology is the study of the normal functioning of the body system. How your body works, how your brain works, how your kidney works, how your liver works, everything that entails it. That's why we have different areas like cardiovascular physiology for the heart, renal physiology for the kidney, and we also have respiratory physiology for the lungs, and gastrointestinal physiology for the opening from your mouth down to your anal canal. I also have neurophysiology, that's for the brain. So we have diverse areas in physiology. So while I was still in school, when we taught about reproduction, so we have reproductive physiology as well, and neuroendocrinology. So during the fact that I was taught reproductive physiology, all those things we mentioned, sexual acts, how does erection start, how does ejaculation start, what to do before you engage in coitus, before you start intercourse. So all those things we are taught, and I know how it works very well.
Impressive. What are some of the other things people can do to improve their sexual performance or their sexual life?
Okay.
As a man.
Okay. As a man, apart from the fact that I already stated that Viagra is not meant for you people, so especially for people having erectile dysfunction. Now, if you want to improve your sexual life, number one is communication. You and your partner must be able to communicate with each other. It does not depend on how long the sex lasts. It depends on how far both of you are satisfied. That's the major thing. So if you can last for 3 to 7 minutes as a man, and your partner is okay with you, then you people are good to go. You must not last for 10 minutes. You must not last for 1 hour, 2 hours before you know that you have. So exercise will be of a great help to you if you want to improve your sexual life. So in case you live a sedentary lifestyle, meaning that you eat, you drink, you go to bed, you sleep. Next day you eat, you sleep, and go to bed and sleep. It won't help you. The best thing for you to do is have a regular exercise routine where you go for workouts, for jogging, for strolling. At least burn out some calories, because when you do exercise, you become more flexible and more light. So it will also help your sexual lifestyle. And also, as I earlier said, lifestyle modification also matters too. Modify your lifestyle.